going back to hyperbaric oxygen, my mentor in plastic surgery, Dr. William Zamboni, he passed away from metastatic renal cell cancer, but he had an NIH grant to study muscle necrosis and hyperbaric oxygen therapy. So from the time I was a med
student, why would people have for surgery? Why would they have muscle necrosis?
In the 80s, he got turned on to it because a young girl fell down a well and suffered myonecrosis, and they didn't have a good way to treat the crush injury that she suffered. And he just became fascinated with increasing oxygen in those tissues to improve viability or stem necrosis.
Right.
So there's lots of examples of this. Think of like diabetic feet or diabetic wounds in general.
Just obvious lack of oxygen.
Right. So, yeah.
So why hyperbaric? Why pressurized oxygen is different? And why would someone...
Because you can just raise the oxygen tension. And it's very safe. Everybody freaks out. I don't know why they still have fires. We do not use pure oxygen. We have oxygen concentrators. You can sit in there on your laptop, have your phone, whatever, drink coffee like I did this morning before I came here. I was in my chamber.
Surgeons are always early risers. I came straight here.
Yeah, I was in the chamber for an hour already, and I did the human regenerative. But
of course, because you woke up before him.
If you increase oxygen, you promote healing. It also reduces your ability to get infection because infection survives in a hypoxic environment.
Low oxygen.
Yeah. Yep. So it's a very nice cheat code for me because no matter what, my patients benefit.
Yep.
They already don't have or shouldn't have problems with infections, but you're creating such a stronger environment for them to thrive by giving them more oxygen.
And they just got cut. So blood flow is not what it used to be, right? So part of the benefits of hyperbaric oxygen is dissolving actual oxygen molecules outside of hemoglobin, and that can dissolve all over the body even without blood flow.
I don't
know why enough people are not doing it.
Well, I try to tell them when they go home too. I'm like, the two things I would leverage, if you can do more of, is hyperbaric oxygen and lymphatic massage. And then they say, oh, I can find a lymphatic therapist. I'm like, that is wonderful. I have one with like 20 plus years experience. She's wonderful. I trust her implicitly. That's not everywhere in the, Spain fits inside of Texas for anybody listening. So our country's size is its asset and its liability.
Yeah.
Trying to get care is very difficult. So these companies, I try to leverage them when we can to really help patients. And then there's, of course, great centers around in different parts of the country. And I know many of them, and they have wonderful, tools that you can utilize. And so that helps a ton of patients as well.
As far as hyperbaric, I'm assuming you're recommending daily, an hour daily, pre-op, post-op?
So what we try to do, because of the time constraints overall, is a minimum like 2 to 3 times a week.
Okay.
And I try to do that as
pre-op and post-op?
Yeah. With the mold folks, it's mandatory, the month before, do as much as possible. And then certainly the month after into the 1 to 3 month window, but certainly the first 30 after like fat transfer. And think of the fat as not, it's trying to heal. So when you take it from one place, unlike the kidney transplant where you hook up the blood vessels or the deep flap, hooking up blood vessels, you reestablish flow. Fat is basically taken from one place and has to heal in another. And it has all of the components or all of the elements, the periocytes, the vascular cells, the stem cells, all the fat cells are there, but it needs to heal. And when you can raise that oxygen tension, that will help it.
Right. And I never thought of it that way. It's like taking a neighborhood of homes and not just transplanting the neighborhood, because you're not cutting out fat, you're sucking out with right. So then it's like taking the homes out of a neighborhood, mixing them all up, and then dropping them in a space. New roads have to be developed to bring blood flow. Otherwise, that's called necrosis and death.